So what first made us consider Arthramid for our practice? And I think that comes down to that arthritis is a challenging disease to treat. I mean, as surgeons, we look at our appointment schedule and we all see the 8-year-old lab coming in for chronic forelimb lameness, and our stomach flips and we get not super excited about that case because we know the diagnostic workup is going to be challenging for that, that it's going to be kind of a long drawn out process, and that even if we find our primary cause associated with lameness, that our treatment options may not be what we want them to be. We may not see the most ideal outcome. And so that's usually the first kind of conversation or first point that I talk to clients about when they come in with chronic forelimb lamenesses is, I'm sure as you've already experienced, forelimb lamenesses are frustrating. And they're frustrating for our patients, they're frustrating for our clients, and they're also frustrating for us as veterinary professionals because we ultimately, as surgeons, like to fix things. And oftentimes it's chronic arthritis that we're dealing with that unfortunately there's not usually a perfect fix for. There's a lot of different things out there on the market that are available to us. And so Arthramid kind of gives us another tool in the toolbox, and probably a really reliable tool that we've seen good results with, and why we wanted to bring that into our practice. We've all used steroid joint injections that usually make some difference, but we don't typically see a lasting impact, and it's more of a Band-Aid, whereas Arthramid seems to have more of a longer lasting impact, and something that we can more heavily rely on and potentially start to take away some of those other medications that can potentially be harmful, like chronic NSAID use and those sorts of things. And I think that's the biggest kind of benefit in carrying that in our practice, is that we know that there's no perfect OA treatment, and that sometimes our surgical options are highly aggressive. And so utilizing this for improving mobility and our patients' quality of life, and potentially, hopefully, staving off some of those more aggressive, potentially less predictable surgical outcomes.